Good afternoon. I am Roy Fidel Hernandez Arnold III, together with Mr. Laureta and Mr. Navarro, and we will talk about investigating sexual abuse. For the list of contents, we have introduction, prevalence of sexual abuse, types of sexual abuse, impact on survivors, legal framework, medical legal investigation process, forensic examination, role of healthcare professionals, support for survivors, challenges in investigating sexual abuse, case studies, ethical considerations, interdisciplinary collaboration, and recommendations and conclusion. First, let us define sexual abuse. Sexual abuse refers to any non consensual sexual activity or behavior imposed on an individual without their freely given and informed consent. It encompasses a wide range of actions, including but not limited to unwanted touching, sexual assault, rape, coercion, harassment, and any form of exploitation of a person's sexuality for the perpetrator's gratification or control. It can occur in various contexts, including intimate relationships, familial settings, workplaces, institutions, and within communities. Sexual abuse is a serious violation of a person's autonomy, dignity, and physical and emotional well being. It can have a profound and long lasting effects on survivors, and addressing and preventing it is of critical importance. Now, here are some crucial points to consider when referring to the importance of investigation in such cases. First, we have ensuring justice for survivors. Thorough investigations are essential to hold perpetrators accountable for their actions. This process helps survivors regain a sense of agency and empowers them in their pursuit of justice. Next, we have protection of public safety. Identifying and prosecuting perpetrators helps safeguard the community from potential repeat offenses. This is vital for preventing further harm to individuals and the broader society. Preventing revictimization. Properly conducted investigations minimize the risk of retraumatizing survivors. Sensitivity and professionalism are paramount to their well being throughout the process. Next, we have preserving evidence. Timely and meticulous medical legal examinations are critical for gathering and preserving crucial forensic evidence. This evidence can be instrumental in building a strong case against the perpetrator. Next, we have maintaining public trust. Thorough investigations demonstrate a commitment to upholding the rule of law and protecting the rights of individuals. This fosters trust in the legal system and law enforcement agencies. Next, deterrent effect. Effective investigations and subsequent legal proceedings serve as a deterrent, discouraging potential perpetrators and sending a clear message that sexual abuse will not be tolerated, which constitutes to holding individuals accountable for their actions, reinforces societal norms regarding consent and respect for personal boundaries. This contributes to a safer and more respectful community. Guiding treatment and support. Medical legal investigations can help inform appropriate medical treatment, therapy, and support services for survivors. Understanding the extent of the abuse is crucial for tailoring care to individual needs. Next, informing policy and prevention efforts. Data gathered from investigations can inform the development of policies and prevention programs aimed at reducing the incidence of sexual abuse and providing better support for survivors. Last, we have fulfilling legal obligations. In many jurisdictions, there are legal obligations to investigate and prosecute sexual abuse cases. This is a fundamental aspect of upholding human rights and the rule of law. Now, let's talk about the prevalence of sexual abuse. Child Protective Services agencies substantiated or found strong evidence to indicate that 57,329 children were victims of sexual abuse. According to statistics, of all victims under 18, 2 out of 3 are ages 12 to 17. 1 in 9 girls and 1 in 20 boys under the age of 18 experience sexual abuse. 82% of all victims under 18 are female, and that females ages 16 to 19 are 4 times more likely than the general population to be victims of rape, attempted rape, or sexual assault. Perpetrators of child sexual abuse are often related to the victim. Out of the sexual abuse cases reported to CPS in 2013, 47,000 men and 5,000 women were the alleged perpetrators, and in 88% of such sexual abuse claims that CPS substantiates or finds supporting evidence of, the perpetrator is male. In 9% of cases, they are female, and 3% are unknown. Now, let's talk about the types of sexual abuse. First, we have verbal sexual abuse, which includes the use of spoken or written words to express, evoke, or imply sexual content. Covert sexual abuse can happen without your knowledge. This includes being observed, followed, photographed, social media stalking, and sexual cyber harassment. Next is visual sexual abuse. Our culture is inundated with sexually charged or sexually explicit images. Being exposed to unwanted sexual content visually is sexual abuse. Next is physical sexual abuse, which includes non consensual touching, fondling, physical restraint, cornering, tickling, kissing, excessive cleaning of genitals, enemas, intercourse, sodomy, oral sex, etc. Last, we have ritualistic sexual abuse, blended with some form of spirituality and ritual. Examples such as child marriage, incest rituals, genital mutilation, and chants or incantations during abuse, all of which constitutes two the kinds of sexual abuse. First, we have rape, which is forced or non-consensual or sexual penetration, including vaginal, anal, or oral intercourse. Sexual assault, any non-consensual sexual contact or activity, which may or may not involve penetration. This can include fondling, groping, or forced kissing. Next is child sexual abuse. Any sexual activity involving a child who cannot legally give informed consent due to their age. This includes molestation, exploitation, or any other sexual act with a minor. Next is sexual exploitation, meaning taking advantage of someone for sexual purposes through manipulation, coercion, or threats, often in exchange for money, goods, or services. Next, sexual harassment, unwanted and unwelcome sexual advances, comments, or behaviors that create a hostile or intimidating environment for the victim. This can occur in various settings, such as the workplace, educational institutions, or public spaces. Next is incest, sexual, ac- sexual activity between family members, such as siblings or parents and children, where there is a significant power imbalance and one party cannot give valid consent. Next is sex trafficking, which is the recruitment, harboring, transportation, provision, or obtaining of a person for the purpose of commercial sex acts in which force, fraud, or coercion is used. Last, we have sexual grooming, building trust and emotional connection with the victim, often with the intent of manipulating them into engaging in sexual activity. Now, let's talk about the impact on survivors. First, physical trauma. Survivors of sexual abuse may experience a range of physical injuries, including but not limited to bruising, lacerations, genital injuries, and sexually transmitted infections, STIs, or diseases. These injuries can be painful and may require medical attention. Next, we have emotional trauma. The emotional impact of sexual abuse can be profound. Survivors often experience feelings of fear, shame, guilt, anxiety, depression, and post traumatic stress disorder or PTSD. They may struggle with trust issues, self esteem, and body image problems. Next is sleep disturbances. Many survivors experience disruptions in sleep patterns, including insomnia, nightmares, and night sweats. Next is flashbacks and triggers. Survivors may have vivid, distressing memories of the abuse situations reminiscent of the traumatic event. Next is relationship difficulties. Survivors may face challenges in establishing and maintaining healthy relationships, both intimate and platonic. Trust issues and difficulty with intimacy are common. Next is substance abuse and self harm. Some survivors may turn to substance abuse or engage in self harming behaviors as a way to cope with the emotional pain and distress. Next is sexual dysfunction. Survivors may experience difficulties with intimacy and sexual function, including problems with arousal, desire, and achieving orgasm. Next is mental health issues. Long term effects can include anxiety disorders, depression, eating disorders, and other mental health conditions. Last, we have impact on daily functioning, in which survivors may face difficulties in various aspects of daily life, including work, education, and social interactions. And let's talk about the role of medico legal support. First, we have providing medical care and treatment. Medical legal professionals play a crucial role in addressing the immediate physical health needs of survivors. This includes conducting thorough medical examinations, treating injuries, and providing preventive measures for STIs and pregnancies. Next, we have forensic evidence collection. Medical legal experts are responsible for collecting and preserving forensic evidence, which can be crucial for legal proceedings. This process must be conducted with meticulous attention to detail. Next, we have empathic and trauma informed care. Medical legal professionals should approach survivors with empathy, understanding, and the recognition of the trauma they have experienced. This can help create a safe and supportive environment for the survivor. Last, we have referral to support services. Medical legal professionals should be well informed about available support services and provide appropriate referrals to help survivors on their path to justice. And now, allow Mr. Laureta to further your knowledge about the medical legal investigation process.
Medical legal investigation process, international and national laws. The Convention on the Rights of the Child, or CRC, the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention Against Transnational Organized Crime, or UNTOC, the Protocol to Prevent, Suppress, Punish Trafficking in Persons, especially women and children, supplementing the United Nations Convention Against Transnational Organized Crime, or Trafficking Protocol, the Rome Statute of the International Criminal Court, or ICC, Republic Act No. 8353, also known as the Anti-Rape Law of 1997. This law defines rape as the carnal knowledge of a woman by force, threat of force, physical violence against the woman or her direct ascendants or descendants, or intimidation. It also defines other forms of sexual abuse such as acts of lasciviousness and rape by sexual abuse. Republic Act No. 11648, also known as the Anti-Rape and Sexual Abuse of Children Act. This law expands the definition of rape and sexual abuse to include acts committed against children. It also increases the penalties for these crimes. Republic Act No. 11930, also known as the Anti-Online Sexual Abuse or Exploitation of Children Act and Anti-Child Sexual Abuse or Exploitation Materials Act. This law criminalizes the online sexual abuse and exploitation of children. Reporting obligations. So the examples of mandatory reporters include medical professionals such as doctors, nurses, and social workers, teachers and school counselors, law enforcement officers, child care providers, clergy members, mental health professionals, and government employees who work with children and families. Rights of survivors. The Sexual Assault Victims Bill of Rights was enacted in 2019 to outline basic protections and fundamental rights for survivors. Survivors have the right to choose whether to report to law enforcement, be free from any suggestion that they must report the crime to have their rights guaranteed, be free from any suggestion that victims should refrain from reporting crimes in order to avoid unwanted personal publicity, and have their report of sexual assault treated seriously. Initial assessment. Initial assessment should include the following. Medical history. The healthcare professional should ask the victim about their medical history, including any allergies, medication they are taking, and any chronic medical conditions. History of the abuse. The healthcare professional should ask the victim about the abuse, including the date, time, and location of the abuse, the identity of the perpetrator, and the nature of the abuse. Physical examination. The healthcare professional should perform a physical examination to assess the victim's injuries and to collect forensic evidence. Mental health assessment. The healthcare professional should assess the victim's mental health status and provide support if needed. Triage. Once the initial assessment is complete, the healthcare professional will need to triage the victim. This means determining the priority of the victim's needs and providing care accordingly. Victims with life-threatening injuries or mental health problems will need to be seen immediately. Victims with less severe injuries or mental health problems may be able to wait for care. A forensic examination in a sexual abuse case typically includes the following steps: medical history and interview. The forensic nurse or examiner will ask the victim about their medical history and about the abuse that occurred. Physical examination. The forensic nurse or examiner will perform a physical examination to assess the victim's injuries and to collect forensic evidence. Evidence collection. The forensic nurse or examiner will collect forensic evidence such as swabs, scrapings, and clothing. Medical treatment. The forensic nurse or examiner will provide medical treatment to the victim such as treating injuries and preventing sexually transmitted infections or STIs. And emotional support. The forensic examiner will provide emotional support to the victim and will provide them with information about their rights and options. DNA evidence can be obtained from your body, your clothing, and other personal possessions in addition to the crime site in cases of sexual assault. It is feasible for you to obtain crucial medical treatment and preserve potential DNA evidence by having a sexual assault forensic examination, sometimes referred to as a rape kit. The examination procedure does not need you to report the crime in order to receive one, but it does allow you to securely retain any evidence in case you subsequently decide to report. The term rape kit to refer to a sexual assault forensic exam. The term rape kit actually refers to the kit itself, a container that includes a checklist, materials, and instructions, along with envelopes and containers to package any specimens collected during the exam. Interviews and statements. Forensic examination interview in a sexual abuse case. Create a safe and supportive environment for the victim. This means ensuring that the victim feels comfortable and safe talking about their experience. Be respectful and compassionate. Listen to the victim without judgment and believe them. Use age-appropriate language. Ask open-ended questions. This will allow the victim to tell their story in their own words. Avoid leading questions. This means asking questions that do not suggest the answer. Do not pressure the victim to disclose information that they are not comfortable disclosing. Take breaks as needed. The interview should be at the victim's pace. Document the interview thoroughly. This includes taking notes and recording the interview with the victim's consent. Be clear and concise. The statement should be easy to read and understand. Be accurate. The statement should accurately reflect the victim's account of the abuse. Be objective. The statement should not contain any opinions or interpretations. Use the victim's words whenever possible. This will help to ensure that the statement is accurate and that it reflects the victim's perspective. Have the victim review and sign the statement. This will ensure that the victim agrees with the contents of the statement. Techniques and procedures. In-depth interviews with non-physician healthcare providers working in community settings and focus groups with women in reproductive age were carried out as part of a wider study on reproductive healthcare in community settings. Discussions on group dynamics provided insight which is especially useful when examining members' common experiences. Focus groups provide inefficient, inefficient means of comprehending how women frame sexual assault in the larger context of their lives, as lifestyle and context might influence women's reproductive health decisions. The interviews provided information about how conversations about sexual assault take place during gynecological and obstetrical visits. Collection and preservation of evidence. For collecting and preserving evidence in sexual abuse cases, collect evidence as soon as possible after the abuse occurs. This will help to ensure that the evidence is not lost or destroyed. Wear gloves and other personal protective equipment or PPE when collecting evidence. This will help to prevent the transfer of DNA and other biological material. Document the collection of evidence carefully. This includes taking notes and photographs of the evidence collection process. Store evidence in a secure location. This may mean storing the evidence in a locked room or in a police evidence locker. Protect evidence from contamination. This means keeping the evidence away from heat, moisture, and other potential contaminants. Preserve evidence until it is needed in court. This may mean storing the evidence for several months or even years. Support for survivors of doctors. Provide a safe and private space for the survivor to feel comfortable talking about their experience. Conduct a thorough physical examination to check for injuries and collect forensic evidence. provide information about the survivor's options for reporting the abuse to the police and seeking medical and mental health care. Refer, to, refer the survivor to the other resources such as mental health counseling, victim advocacy services, or legal aid. For nurses, provide compassionate and supportive care to the survivor throughout the entire process, from the initial examination to the collection of forensic evidence. Educate the survivor about their rights and options. Refer the survivor to other resources. For forensic experts, collect forensic evidence in a way that is sensitive to the survivor's needs. Explain the evidence collection process to the survivor and answer any questions they may have. Testify in court and about the evidence they collected. Confidentiality and compassion. Inform survivors of their confidentiality rights. This should be done in a clear and concise way, both verbally and in writing. Only share survivor information with others on a need-to-know basis. This may include other support providers, medical professionals, or law enforcement. Take steps to protect survivor information, such as using secure computers and files. Be mindful of survivors' privacy when talking to them in person or over the phone. Listen to survivors without judgment and believe them. Offer survivors support and empathy. Collaborative efforts with law enforcement. A law enforcement officer might partner with the victim advocate to accompany a survivor to the hospital and to provide support during the forensic evidence collection process. A law enforcement officer might participate in an MDT meeting to discuss the survivor's case and to develop a plan for responding to their needs. A law enforcement officer might revert a survivor to a victim advocacy organization for additional support. A law enforcement officer might provide a survivor with regular updates on the status of their case.
Good afternoon, everyone. I am Lance Jedrick D. Navarro and will continue the report about the challenges in investigating sexual abuse. Investigating sexual abuse can be challenging for various reasons, and there are issues that law enforcement, healthcare professionals, and social workers often encounter. First one is underreporting. Second one is lack of evidence. Third one is victim blaming, and stigma, cultural, and societal barriers. First one is underreporting. Fear of retaliation. Many victims are afraid of retaliation by their abusers if they report the abuse. This fear can be well founded as abusers may use threats and intimidation to keep their victims silent. Number two is lack of trust in authorities. Some victims may lack trust in law enforcement, social services, or legal system, particularly if they have had negative experiences in the past or fear further victimization. So nangyayari lang to kapag yung may trauma na yung victim natin about dun sa law enforcement and especially dun sa mga abusers. Number two is lack of evidence. Sexual abuse often occurs in a private settings, making it challenging to gather physical evidence or witnesses. In cases of historic abuse, evidence may have been lost over time. Number two, many victims delay reporting due to fear, shame, or other factors, which can result in the loss of crucial forensic evidence. So stated naman po dito na nangyayari kasi yung mga sexual abuse sa mga private settings or sa mga lugar na malayo na or hindi natin alam kung saan or madilim. Kaya mahirapan talaga yung mga law enforcement natin na maghanap ng evidence kasi hindi natin makikita yung or alam yung exact na place na nangyari yung krimen. So dito, many victims delay reporting due to fear, shame, at marami pang factors kasi natatakot sila na baka, or nahihiya sila na malaman ng lahat yung about sa nangyari sa kanila. Victim blaming and stigma. Victim blaming is a pervasive issue where survivors of sexual abuse, victim blaming and stigma. Victim blaming is a pervasive issue where survivors of sexual abuse are unfairly held responsible for the abuse they endured. This blame can deter victims from reporting. So dito sinasabi na kung sino pa yung nagsumbong, sila pa yung nasisisi. Stigma associated with being a survivor of sexual abuse can lead to feelings of shame and guilt, discouraging victims from seeking help and justice. So stated naman po dito na nadi-discourage yung mga victim natin na humingi ng tulong or mag-seek ng justice talaga. Cultural and societal barriers. Cultural norms, religious beliefs, and social attitudes can create significant barriers to reporting sexual abuse. In some cultures or communities, discussing such issues may be taboo or strongly discouraged. Societal pressure to maintain the family's reputation uh, and avoid public scandal can make it difficult for survivors to come forward, especially if the abuser is a family member. Case studies. About 7 million children are sexually abused every year in the Philippines. More than 70% of sexually abused children are between 10 and 18 years old. Among those victims, 20% are under 6 years old. So this is about a case of a 12-year-old named Elsa. Uh, she came to the journey after child abuse team after she had been sexually abused by a young man who was a friend of the family. Both at home and at school, Elsa was really miserable. She was having a terrible time falling asleep at night. And when she did, she would wake up with nightmares after a rough night. She would frequently wake up with a nasty temper and dispute frequently with her parents. Elsa was preoccupied with a multitude of issues. Elsa struggled to focus in class and frequently became so upset that she had to leave. She sometimes wanted to die because she was so miserable. Elsa's mother attended JACAT or the jacket meetings with her, and they decided that their wish was for her mother to take a partial leave of absence. So, itong case na to is about, yun nga po kay Elsa, yung 12-year-old kid na abuse ng batang lalaki din na friend of ng family nila. Ethical considerations. Ethical considerations are crucial in various aspects of addressing and supporting survivors of sexual abuse. Three important ethical principles that should guide actions and decisions in this context are informed consent, trauma informed care, and cultural sensitivity. Ethical considerations in addressing sexual abuse, such as informed consent, trauma informed care, and cultural sensitivity, are vital to ensuring that survivors are treated with dignity, respect, and empathy. These principles help protect the rights and the well being of survivors and are essential in guiding professionals and organizations in their efforts to support and assist those affected by sexual abuse. So sa informed consent and the consent of sexual abuse, this means that survivors should be provided with clear and comprehensive information about any medical examinations, legal proceedings, therapy, or support services they may receive. They should have the autonomy to make decisions about their own care and participation in investigation. In trauma-informed care, practitioners and service providers must be sensitive to the potential uh, retraumatization traumatization. In informed consent, in the context of sexual abuse, this means that survivors should be provided with clear and comprehensive information about any medical examination, legal proceedings, therapy, or support services they may receive. They should have the autonomy to make decisions about their own care and participation in investigation. Trauma informed care. Practitioners and service providers must be sensitive to the potential retraumatization of survivors during investigation and therapy. They should create an environment that minimizes the triggers and promotes a sense of control for survivors. Lastly is the cultural sensitivity, understanding and respecting cultural norms and expectations related to disclosure, seeking help, and coping with trauma are essential in providing effective support and care. Uh, So in interdisciplinary collaboration, it is the most effective when there is open communication, information sharing, and shared commitment to the well-being of survivors. This approach helps ensure that survivors receive holistic support and that their physical, emotional, and legal needs are addressed. Additionally, it can contribute to improve prevention strategies and more effective responses to sexual abuse within communities. For recommendations and conclusion, first one is a recommendation for strengthening medico-legal response. First one is the training and sensitization, protocols and guidelines, interdisciplinary collaboration. For recommendations for raising awareness and education, first one is comprehensive education, public awareness campaigns, and online safety. Uh, Last one is the recommendation for supporting survivors on their journey to healing, trauma-informed services, legal advocacy, and crisis helpliness. These three are interconnected strategies that can lead to more effective prevention, response, and recovery. By implementing these recommendations, societies can work towards a future where sexual abuse is less prevalent. Survivors are empowered to come forward and access the help they need, and the justice system is better equipped to hold perpetrators accountable. Ultimately, the goal is to create a cultural or of empathy, support, and safety for all individuals, free from fear and trauma of sexual abuse. That is all. Thank you.